Right, so let's discuss this further. We're going to be joined via Zoom by Sherwin Charles, Director of Goodbye Malaria South Africa. Well, Dr. Sherwin, good afternoon. Thanks for your time with us here on the SABC.
Thank you very much, Lizo.
Just on the back of the cases that have been reported in Limpopo since the beginning of April, talk to us about the phenomenon that is occurring. Is malaria common, especially at this time of the year?
Malaria in South Africa is a seasonal disease, and we do see cases in April and May each year. However, the cases tend to be waning as it's the end of the malaria season. There's been certain climate challenges that we've faced this year, where we've seen floods and Cyclone Freddy affect our neighbors. And what we're seeing is that there's an outbreak of malaria given the standing water, given the flooding that has taken place. And it's an outbreak that is unusual given the time of year. And I think what we're seeing in Limpopo is part of the challenge, where we now see climate change and health intersect. I think that April is a month where we see lots of travelers coming from other endemic areas or people traveling in the province. But we also have seen lots of standing water. And these, of course, are the breeding grounds for these mosquitoes. Thus the uptick in malaria and the surge we're now noticing.
You've spoken about the intersection of climate change and health, and also, how these challenges, especially from floods and Cyclone Freddy, have now contributed or served as driving forces behind the surge in cases. Perhaps for those who are not privy to the nature and characteristics of malaria, what varieties of malaria are known to exist? Perhaps talk to, let's start there perhaps before we look at the onset of symptoms.
So I think what we see in our region is what is known as falciparum malaria, really carried by the female Anopheles mosquito. And this is what we see. The behavior of the Anopheles mosquito is that they tend to bite at dusk and at dawn. So you're at greatest risk at dusk and at dawn. And I think the government within Limpopo in particular has said that there's been an IRS campaign that they've launched. This campaign looks to protect people within their houses. The type of malaria that we generally see, the transmission happens within the house. It's not often, although it definitely can happen, that you would be bitten outside during the day and be at risk of getting malaria. So really it's people taking precaution early evening and late into the night, early morning is when they need to ensure that they are protected. If you're in and out of the house at that time, try and wear long sleeve clothing or socks. Keeping the ankles protected are very important as well.
Yes, with just the context on the back of what you've echoed now, how long is the incubation period or the onset of symptoms, once the Anopheles female mosquito has bitten a human host? In the same breath, what are some of those signs and symptoms that one has to look out for?
So it's generally 5 to 8 days before one would get the onset of the symptoms after being bitten. And the symptoms are very much flu-like. As you heard in the insert, someone complaining of headaches, fevers, shivering, sweats, diarrhea. That is the symptoms that are linked to the type of malaria that we have in this region. It's very, very important that on the onset of symptoms that one gets tested very quickly. To effectively treat malaria, the quicker the diagnosis and the quicker that the treatment can be administered, the less the symptoms will persist and the less severe the malaria case will be. So we really want to encourage people that when they experience such symptoms, do a malaria test. It's quick, it's easy, it's cheap, and they should be readily available from the Department of Health, clinics and hospitals.
Sherwin, just very quickly as we wrap up, earlier on you spoke about taking precautions. You included high-risk hours, include dusk and dawn. Perhaps you could just quickly speak to the treatments available, some of the preventative measures that are in place. We're also looking at the rate of recovery for those who obviously have been infected.
So I think there are preventative measures, but the preventative measures are more for people who are coming to visit into an endemic area. If you live within the endemic area, the preventative measures are not generally suggested for one to take a prophylaxis. I think the preventative measures that need to be in place are more around ensuring no standing water around your property, ensuring the area is clean, and ensuring that you take some precaution. Using repellents, such as lotions, work very, very well. So if you've got a good repellent, that will definitely protect you as well. If you have access to a malaria-treated bed net, that's also another preventative measure that can be taken. We don't have bed nets generally within our environments, as the preferred vector control is the indoor residual spraying.
Dr. Sherwin, thank you for joining us here on the SABC for just highlighting the impact of malaria, perhaps preventative measures as well. This, of course, in the back of the upsurge in cases of malaria in Limpopo, this since the beginning of April. Sherwin Charles, Director of Goodbye Malaria South Africa, weighing in on that.